And you're one of those people that you are practicing what you preach. You're using these things, okay?
Oh yeah.
There you go.
Absolutely.
So give people kind of an understanding of like things that you do today that you're like, hey guys, speaking from, because we talked about stem cell, your shoulder. So that's something that you did, you believe in it, you actually practice it, and it worked. Tell me right now, like, I guess your Lawrence Bourgeois, Dr. Lawrence Bourgeois stack, if you will.
The stack.
Let's do it.
Right now, again,
The
like I
doctor
said,
stack.
now they rotate, right? But
Yes.
right now, what I'm doing exactly.
Yeah.
I had like a tennis elbow from working out.
Yep.
So it's lateral epicondylitis right here, right? So what I do is I take the Wolverine stack.
There
right?
you go.
The Wolverine, and you can actually inject it right in your area of pain.
Gotcha.
I mean, no bullshit. Like I started like probably a week ago. It's almost all the way healed. I mean,
Very cool.
and it was bothering me for, a month or so, and I was just on a different stack. So that, then you can do the tesamorelin.
Yeah.
For, again, that's going to be to reduce fat, but also gain muscle mass as well, and anti-aging, right? So that's what I'm doing. Those are two I'm doing right now. Third one's Motsi. It's my favorite. That's probably my favorite. And then I did a month that I'm coming off now, retatrutide.
Yeah.
Because honestly, we don't give anything to our patients that we don't do ourselves.
I like
right?
that.
Yeah, I mean, I'm not gonna read a textbook or AI something and say, hey, this is what it does, right? No. I'm gonna be able to speak to it.
Yeah.
So Motsi, heard great things. I did it. I'm like, man, now I can't give this to enough people because I want everybody to feel how amazing this feels, right?
Yes.
My experience on them, of course, retatrutide, crazy weight loss.
So that one, even for you, is working like you're like, this is working fast.
Oh, I'm getting off. It's only been a month and I'm getting off. Yeah, no, I'm down like 15 probably. And
that's not normal. That's like a good bit of weight, like for like a lot of people. 15 pounds is a lot.
But guess what? I'm the same, if not stronger. And I did, like, for instance, I do 225 for 14.
Mm-hmm.
I hit it 15 the other day.
Okay.
So it's like, okay, the strength is still there.
Exactly.
Right? So I lost the fat. And I wasn't somebody who had a whole bunch to lose, right? I was never, I'm never that guy.
Yeah, you weren't really like thick.
But look,
you weren't a thick boy.
Look, but look, like I said, we're not going to give it to any patients without trying, right? I need to know how it makes you feel.
True.
Everything, right? So that's the main reason I did it. It's awesome. It's awesome. You don't have a big drop in your energy like people say with the other GLPs like semaglutide or tirzepatide.
So you would say out of all the stem cell packs that you've got, like this is the one product that you'll stand by. You're like, hey man, not only does it work fast, it's effective, and you're not seeing the side effects yourself. Or you're like, no, actually, we're only seeing upside with Reta.
Yeah, I'm not seeing any in any patients either.
Yeah.
I mean, common side effects with the other GLPs is nausea.
Mm-hmm.
I haven't seen maybe one, and it's mild, right? We're not talking throwing up or anything like that. I'm talking very, very mild. Yeah. But the reason too why that is as well is we monitor it, right? Everybody starts at the correct dose from based on their blood work and everything, what it looks like, right? So we're very, very, very careful. Mm-hmm. This isn't quick. We want quick results, but we want lasting results. We want safe results, right? This isn't just a quick grab, get some quick results and harm the body, right? So you got to look at it from a whole picture, whether it's hormone or peptide or stem cells, right? Sure. And ultimately, all of them for most people can be very beneficial, just depending.
You and I have definitely talked about this. You have your own theories about it. We've even seen the guy on Netflix. You saw that documentary where the guy pretty much uses the don't die guy. Don't die guy, yeah. And it seems like he kind of has a very similar belief that you do, where it's like, if you take every single precaution, you can far exceed what people are doing today.
At this point, it's not a theory or belief. Okay. It's true. I mean, it's true. If you follow the research, follow the evidence, it's a fact. I mean, we're living in a time that this has never happened in history. Yeah. This is the most revolutionary in every field, honestly, but just human life, civilization, right? I mean, I firmly know that, right? Yeah. When it comes to the human body, we're going to be able to extend things far past what anybody can even fathom at this time. And it's going to be way, way sooner than you think.
I believe that specifically because, I listen to clips of Elon and whatnot, and he talks about how, introducing AI and making it, like you said, everyone's using AI. Everyone's exploring AI. I don't know if you do this. I find myself doing this, or I'll just talk to it, and just
all the time, man.
Run through every thought that's through my mind. And I'm sure there's people who are probably much brighter, who are, who knows, like astrophysicists who are exploring their AI program far more than, you and I are. But that's what I'm seeing, is that the fact that it's growing too fast. So what you're telling me, like, hey, longevity is going to spike, right?
Soon.
I would think it's going to align with us having this technology that is going to say, no, I can take y'all there, and this is how,
Well, check this out. Like, this is like 2 weeks ago, I think. Like 2 or 3 weeks ago, it was the Sam Altman, the ChatGPT guy, right?
Yep.
He started a company. I forget the name of it exactly, but you can look it up. We can look it up later. It's basically it's a pill. It's some type of molecule, and it's only in phase 1 trial, so it's super, super early, right?
Right.
But basically, you take it, and it just gets rid of all issues in your body before they happen.
That's so. I was not even.
How do you even die?
Yeah.
Right?
Like,
so if you were going to, and including cancers and stuff, that's what they're working on, right? It's all AI developed. So it's like, all right, if you were gonna have like pancreatic cancer, which is like a death sentence, right? By the time they find it, usually you pass away. If you were gonna have that, well, what if it never starts? And that's like with every other process. Heart disease, what if it never starts? I mean, so if you can stop all these conditions, it really changes everything. Like, for instance, they have now little bots they're in trials right now, but they're working really well. It's like these little bots that they're putting in your arteries. And instead of having to go get stents in and all these like heart surgeries, they're literally chipping away like little builders, like workers in there, and they're chipping away at the plaque that's blocking the arteries, right? So it's just it's kind of crazy where things are going. All the things that right now that cause death, we're fixing where they don't cause death anymore.
Yeah.
So it's like, okay, well, people just pass away from accidents, and then they're even doing things where they're transplanting heads on people. I mean, it's crazy.
I mean, science definitely is going outward, and I mean, everything's on the table now with the way things are moving way too fast. So, I'm not saying no to anything. I question everything, obviously.
Of course, you have to.
You got to.
Have to.
So, and it kind of brings you to the next question, which you and I, we would see it online. We would casually laugh about it, and it's not nice to say, but people would say, "Oh, you're not ugly or anything like that. You're just broke," It sucks to say that, but it's true. It's like, I think,
this day and age, it's
sad, look, it's savage. It's super, as they would say, it's red pill, whatever. But and this gets into Lookmaxxing, right? And we were gonna move into this as well. But when you hear that term, right, and it's getting kind of like villainized in its own right. Okay, men that are Lookmaxxing, or I don't know. I guess the younger generation came up with it.
Yeah.
So when that happens and you hear that, I mean, obviously this leans directly into your industry. So what do you think about it?
I mean, honestly, it depends on what extent, right? Like, exactly. I'll kind of break it down.
Yeah,
right?
Please.
Like Lookmaxx, like if you look at it, like what I think the definition of Lookmaxx would be to me is look the best you can, be healthy, be vibrant, treat your body very, very good, because when you treat your body good, you look better. That's just how how it works. Like, whatever you're doing on the inside is going to reflect on the outside. Right?
Yeah.
So in that sense, absolutely, right? If somebody doesn't like how they look in some way and they're able to change things and it makes them feel better, then awesome. Like, I'm not against any of that. It's great.
Yeah.
Right? It's when you hear people that are doing stuff that are really going to damage themselves, so extreme that, I mean, they could die from, right?
Right.
That's where I think you got to draw the line, because then there's some other issues.
Yeah.
But just trying to look the best you can, feel the best you can, as long as you can, I like it. I think it's good. And people like to do all these different procedures. Like at our clinic, nurse practitioner Victoria, she does all the aesthetic procedures and everything, and she helps a lot of people. So it's cool. She's a model, so she really has an eye for that type of stuff, right?
Yep.
So when it comes to like fillers or Botox or any other type of like aesthetic procedures, microneedling, stem cells, things like that. I mean, you get people here who are really not feeling too good about themselves, to be honest with you, right?
Yeah.
And then they do these procedures, and they're a different person. So it's like, they Lookmaxx and they made them a better them. I'm all for that, right? Yeah. Even if they have to do some surgeries, that's kind of controversial to some people. I'm all cool with that too, personally, as long as it's not anything. If somebody's doing some crazy drug that could kill them and they're abusing it, for instance, if somebody thinks Lookmaxxing is blasting 2,000 milligrams of testosterone a week, it's not Lookmaxxing. First off, you're going to look worse. Yeah. Second off, you have a heart, you can kill yourself. Yeah. So you gotta really manage what people are thinking when it comes to it. I guess if it's like a mental condition or if it's just somebody who just wants to be the best as they look, right? So I'm all for Lookmaxxing.